Hi there, my name is Brittany Wyman, and I'm here to discuss my business proposal for Compassionate Care Adult Daycare Center. The need for adult daycare centers is on the rise and something that we need to implement more nationwide. In the United States, the elderly make up 13% of the population and account for 34% of personal health expenditure, with Medicare spending accounting for 20% of the total national health expenditure. Adult daycare centers are a solution to help prevent isolation, depression, and a decline in cognitive function, along with physical function of elderly adults and those young adults with disabilities. Adult daycare centers are a way to allow for those that are taking care of the individuals to be able to keep their job while also allowing for the individual who is receiving care the opportunity to grow socially and educationally, while being supported by a staff that is professional and compassionate in nature. These types of programs have the potential to help shape health system interventions, especially caregivers and individuals requiring assisted care. So we will be going over the mission and vision of Compassionate Care, talking about the competitive environment, some local, state, and federal regulations, key marketing strategies, HR plan with the projected positions for the first year, and then we will go over the 1-year budget. So the mission is statements are essential for organizations so that it can provide a guide of the overall direction and lead everyone towards a common goal. The mission of Compassionate Care is to help our adult and elderly customers with their independence and healthy living for as long as possible in a cost-efficient and cost-effective manner. A vision statement is essential because it determines what the future of the company consists of. Our vision statement provide the best adult daycare center in the DFW Metroplex, where the customers thrive and their quality of life is restored. It was important to us to get together as a team and define this criteria first. Understanding what we stand for and where we want to go allows us to have an understanding of what we are looking for when we begin to hire. The nature of Compassionate Care will be one that provides courses, events, and services that will continuously motivate and educate our customers while creating an environment where socialization and exercise are part of their everyday use. It is important to understand and listen to the needs of our customers and their loved ones in order to provide a nature that is desirable and a place that they are excited to be a part of. The services and products that we will provide at Compassionate Care consist of counseling, education, exercise, health screenings, meals, therapy that consists of speech, occupational, and physical, medication management, respite care, socialization, transportation for those that need it, supervision, and assistance with daily activities such as toileting and grooming. We will provide services for adults 18 and older who are special needs, elderly, relatives, friends, or neighbors. Research suggests that there are positive outcomes for participants of ADS centers, including improved psychosocial outcomes, reduction in program behaviors, and delayed nursing home replacements. A common type of care is home health. The reason being is this type of care can be conducted within the comfort of the individual's home. However, the reason that adult daycare center programs are better is because it helps the individual thrive and allows the caregiver the opportunity to continue to work. With home health care, you are restricted to your house and it prevents your caregiver from being able to work in order to provide the means necessary for your family, which in turn puts a strain on the house. With this type of care, we are allowing for these individuals to see a different side of life. Evidence shows that older people who attend these centers have a better quality of life. Our major competitor would be Friends Place, which is an adult service located in Richardson, Texas. They are well known and a frequently sought after program. Within Texas, there is a legal obligation with Medicaid programs to make sure one registered nurse or vocational nurse is on site at least 8 hours per day to be able to assist with nursing needs of the clients within the organization. All staff has to be provided with training in the following categories: fire, disaster, and evacuation procedures. These trainings must be provided within 3 workdays after beginning of employment, and providing direct care staff with a minimum of 18 hours of training within the first 3 months of employment. Adult daycare centers in Texas have to be licensed and overseen by the Texas Department of Aging and Disability Services, also known as DADS. We understand that we will have to fill out Form 3720 and check the box for adult daycare facility, and then return the application to the DADS office. We will have to have this document along with a licensing fee, which is about $75 for 3 years and $50 for 2 years, a fire marshal inspection report, Form 3654, a management company agreement 60 days before the requested date of issuance of license. This is according to the Texas Administrative Codes. If we have any changes that we need to submit, we will have them to DADS at least 30 days before the changes take place within the organization. With marketing, it is important to know and understand your audience. Being able to integrate yourself in with the community, hear what their needs are, will assist us whenever we are trying to bring in our clients. Placing ads in local newspapers or community health newsletters will get our company seen and heard. We would offer an open house for potential clients to come in and tour the facilities while bringing their families and loved ones. We would have our staff available to do a meet and greet along with answer any questions that they may have. We would provide brochures that would be able to be passed around to local hospitals and rehabilitation centers. Becoming a part of a well-known organization is also something we strive for, such as AARP or the Alzheimer's Association. This will allow our clients to see that we are a credible source and have the best interests of those in our hands. We also would want to get into contract with the Veteran Administration Hospital. Texas is well known for their military background. We will do everything and anything in our power to support those who have fought for our country. And then lastly, social media is the easiest way to get information out there for the public. So a program Facebook page could serve multiple purposes. It has the ability to inform the general public about the program, but also creates an added way of communicating with and supporting registrant families. We will provide the means necessary to give the families the information they require in order to make the best decision for their loved ones. We would bring in a hiring consultant to make sure that we are following all of the appropriate rules and regulations with hiring, along with making sure that the employees are getting paid fair and equal. The applicant would have to pass a drug screening and match the type of the employer that we are looking for. According to the Texas Administrative Code Title 40, Part 1, Chapter 98, Subchapter D, Rule 98.62, within the state of Texas, there is a requirement to fill the positions of the facility director, which must be held by an RN, activities director, facility nurse, attendants, dietitian consultant, service staff with a ratio of staff to participant of 1 to 8. We plan to start the business out with allowing 24 residents in and growing from there. Therefore, we would hire 3 service staff members. Food personnel, housekeepers, drivers, and that would be it that we would start out with that first year. Therefore, our organization understands and will adhere to this requirement. We only want to bring in the employees that want and desire the same mission and vision that our organization has. When we surround ourselves with compassionate and innovative individuals, the organization is sure to thrive. Construction of the spaces that we have provided will be one of the first priorities. This will consist of creating those rooms for the services that we provide: counseling, education, exercise, health screening, meals, therapy, medication management, socialization, and assistant with daily activities. Also nap rooms, because napping is also important. This will cost about $40,000 once we add in paint, carpeting, and then creating the room dividers. Then we will need to furnish these rooms and create space for medical equipment, which would add on an additional $27,000. We will look for bargain deals and rent if need be. Our primary concern, first and foremost, will be the safety of our clients and of our staff. On average, office space in Dallas runs at about $22 per square foot, which means our yearly rent for our 10,500 square foot building would be $231,000, or a monthly expense of $19,250. The size is important in making sure that our guests have an adequate amount of space to move freely and safely. Our utility bill, which consists of water, trash, electricity, gas, phone, internet, and cable, would range around $18,000 a year. The average monthly cost per square foot is 7 cents per square foot. In order to have an electronic health records account, it will cost us $20,000 to purchase, install, and provide proper training to run the program to our staff members. This system is important for us to be able to keep track of patient information and be able to access it quicker while adhering to the HIPAA protocols. Salaries is where we will see the largest contribution. According to Salary.com, a registered nurse in Dallas receives a median pay of $63,000. An adult daycare director receives a median of $94,380. Everything added together would bring our yearly budget up to $698,559. Between savings and donations from family and the community, we have been able to generate $350,000. We have requested a business loan for the remainder, $348,559, and have been approved. Therefore, at the conclusion of this meeting, we are hoping that we can move forward. I appreciate your time.